Good evening, and thank you, everyone. Welcome, everyone, for joining us this tonight. My name is Rashid Shabazz. I'm the Chief Marketing and Storytelling Officer at Color Change, and excited and happy to be here to introduce tonight's event. I want to start by first thanking One World for the opportunity to partner with them. Chris Jackson has built a stellar roster of some of our greatest minds, helping us to better understand how we create a truly just and equitable world. So thank you to Chris and to my amazing and dear friend, Elizabeth Mendez-Berry, for thinking of Color Change to create this virtual space for a conversation that between two brilliant and brave writers whose work proves that inequality is both a moral crisis and a public health crisis too, something that this pandemic is making very clear. I also want to shout out my colleague, Whitney Buggs, and our entire team for always ensuring we can be part of these partnerships. As the largest online racial justice organization in the country with over 1.7 million members, Color Change works tirelessly every day to end injustice by mobilizing the power of our members and allies to hold accountable those in positions of power whose decisions, as we have seen through this crisis, can literally kill us. Too often our community is killed by bad policies, corporate irresponsibility, racial bias, and all those who profit from racism. And it's not just harming us, but all of America too, and the world. In the beginning of this crisis, our organization launched the blackresponse.org as a hub to lead efforts to protect and fight for our community. We led a campaign to hold Zoom accountable for not doing more to protect us from the white supremacist trolling in chat rooms, when many of us are gathering in this moment simply to find collective reflection, celebration, learning, and healing. We have been leading in partnership with others, raising the alarm of the impact of the virus in prisons and jails. These places we know have long failed our community. They keep people trapped who should be free and keep people away from their families and communities who need them. They are a symbol of racist policies. For example, we see our community being the majority of arrests in New York City for not obeying, quote unquote, social distancing, while their white peers are handed masks and left alone. We have sadly also had to recently respond to the heinous vigilante and state murders of Ahmaud Arbery, Breonna Taylor, and others. But our goal is always to drive people to action. So please visit the blackresponse.org and sign up to learn more about our campaigns. But tonight, Ibram X, Kendi and Dr. Mona Hanna-Attisha will be in conversation with One World Senior Editor, Nicole Counts. I'll be passing the mic to her shortly. They will be discussing their work and why anti-racism and fighting for our communities is more urgent than ever. Prior to joining Color Change, I visited Flint as a member of Blackout for Human Rights, a network of artists, advocates, and entertainers founded by Ryan Coogler and Ava DuVernay. From that visit, I was reminded by both the resiliency of our community and our ability to find solutions and answers in the midst of crisis. But I was also reminded of what we have learned at Color Change, that injustice is not some kind of accident that just happens, but injustice is based on a series of intentional decisions and actions. The level of disregard and incompetence that we are seeing in response to this pandemic and its impact on our communities is the same level of disregard and incompetence we saw from politicians at every level in response to the continuing water crisis in Flint. Tonight's conversation is so critical because we must remember that underlying the pre-existing condition killing Black and brown people is racism and failed government and corporate responses fueling racist policies and practices. I'm excited to hear from these great minds and happy to now pass to Nicole to take it away. And thank you again, One World, for this partnership.
Hi, thank you all so much for joining us tonight. As Rashid said, I'm Nicole Counts, Senior Editor at One World. I'm going to introduce our two wonderful guests in just a minute, but I would like to start with a moment of silence for all the victims of COVID and for the senseless killing of Ahmaud Arbery, Nina Pop, Breonna Taylor, and Calvin Mungary. I'd also like to have a moment of gratitude for all our essential workers, for the doctors and nurses, the bodega owners, the postal workers, the grocery store owners, all of you doing so much to make sure that we are at home safe. So thank you so much. So like I said, this is One World's third Idea and Actions event. And this one will be focused on inequality as a public health concern. And something that I was thinking about before tonight's event was that the original idea of starting Ideas in Action was that we had so many brilliant authors that have radical ideas of how and what our future can look like and how we can shape it. And we have an amazing amount of authors also doing the action behind that work to make it happen. And I think this is kind of a perfect union of a doctor of history and a doctor of medicine coming here tonight. So I will start with introducing Dr. Mona Hanna-Attisha, who is a pediatrician, an activist, and a scientist. She's the author of the New York Times notable book, What the Eyes Don't See, and was awarded the Freedom of Expression Courage Award by PEN America, and was named one of the 100 most influential people in the world by Time Magazine. Dr. Mona, will you join us? Hi. Okay, and now I'm going to introduce Dr. Ibram X. Kendi, who is the New York Times bestselling author of How to Be an Anti-Racist and the National Book Award winning author of Stamped from the Beginning, and the founding director of the Anti-Racist Research and Policy Center at American University. Dr. Kendi, will you join us?
Hey.
Hi. Dr. Mona, you're on mute. It's so good to see you guys. Thank you guys so much for joining. I wanted to start with kind of breaking down some of the underlining issues within the COVID epidemic, which Rashid actually just kind of talked about. So Dr. Mona, you wrote in an op-ed that the upstream threats and the root causes that put your patients and communities at risk. And Dr. Kendi, you know, much of your work has always been dedicated to the racist thought and the racist history that has created these racist policies and the racist country that we live in. So can you guys talk a little bit about these root causes?
Yeah, I can start. So, you know, as a medical educator, I have this amazing privilege of welcoming new doctors to the field of medicine. And they always start on July 1st. So just nobody gets sick in July, because that's when you always have new doctors. But anyways, so when they first start, they have their white coats on and they're full of confidence. And they think that, you know, they're so excited to do what they have been trained for so long to do, which is heal and serve their community. And then one of the things I share with them is that, hey, guess what? You know, medicine actually only contributes about 10 to 20% of health outcomes. That we have to really open our eyes and be cognizant of all these other things that impact if our patients will end up being healthy or end up getting an infection like COVID. So, you know, it's eye-opening for so many of my fellow colleagues that we have to be aware of things like racism and the history of the community that, you know, we are privileged to work in, and poverty and food security and housing security and economic stability, all of these other underlying upstream threats that play a far greater role in the lives of our community than any antibiotic that I can prescribe. So these are the same kind of issues that put communities like Flint at risk, that have put our community at risk. And these are the same kinds of underlying issues that continue to threaten our most vulnerable communities, especially as we're seeing now with the COVID pandemic.
Yeah. Ibram, do you want to comment on that?
Sure. And I guess to add, I think in many ways, many Americans have continued to imagine that this nation is post-racial, in the sense that in the latter part of March, many states, actually almost every state in the country, was not releasing racial demographic data on coronavirus sort of patients, to the point in which we actually had to start calling on states to do so. And then when those states started finally releasing racial demographic data in the beginning of April, and by mid-April, we started seeing these massive disparities, particularly African-Americans dying disproportionately from COVID-19. Then Americans began to see that this coronavirus was not the great equalizer. Indeed, everyone of every race was getting infected and was getting was dying, but the different groups were not being infected and killed at similar rates. And then what was fascinating was then it started to shift. Then you had people making the case that Black people were dying at disproportionate rates because there was something wrong with Black people, that Black people were not taking the virus seriously. Black people were not socially distancing. It just so happens that the Pew Research Center had already done a study in the late March that found that Black people were actually taking the virus more seriously than other groups, that Latinx Americans were also taking it more seriously than white Americans. And then Americans saw that indeed Black and Latinx people were not the ones who were out protesting to open the country back up because they imagined that this virus was a hoax. So then they started switching to, okay, it's not that these people are not taking it seriously, it's because they have these pre-existing conditions. And the reason why they have these pre-existing conditions is because they're more likely to be obese. And the reason why they're more likely to be obese is because they're undisciplined and they're lazy and they refuse to take health care of themselves. That's why they're more likely to have asthma and heart disease. And it just so happens, though, that recent studies have come out that have stated, as Dr. Mona stated, that other social determinants of health, like access to health insurance, like poor air and water quality, are actually more predictive of infection and death in COVID-19.
I just want to make sure that everyone knows about your project, which is, the COVID racial data tracker. And in one of your Atlantic articles, you wrote that, how can we defend American people if we don't know where the battles are? And so something that I thought was interesting when I was doing some more research for this talk was that, in Dr. Mona's home state of Michigan, both of you cited about the 40% of people killed are Black versus the population is 14% of the population is Black. And Dr. Ibram, you used that as part of your reasoning of why we needed a COVID racial data tracker. So could you just talk a little bit more about that project?
Sure. So as states, particularly by mid-April, began releasing racial demographic data, the federal government, of course, wasn't collecting this data. And so we decided, my colleagues at the Anti-Racist Research and Policy Center, we decided to partner with the COVID tracking project to create this COVID racial data tracker. And what we're doing, or what we've been doing since mid-April, is continuing to put pressure on states to release racial demographic data. Now 48 states have released some form of racial demographic data, largely and somewhat because of our sort of network. We've also been collecting that data and displaying that data on our website, covidtracking.com/race. But then we're also ensuring that people on the ground in Michigan, in other states and in other cities can use this data so they can see exactly who is the most vulnerable populations in their states.
Right. That's amazing. Something that I really hope comes out of all this is that we use things like the COVID racial data tracker as a standard, and as protocol for future, public health issues or events, hopefully never a pandemic again. But so it's clear to me from what you guys are saying and just in general, the underlining diagnosis of COVID is racism, and as Dr. Mona, you've put it, our chronic dismissal and our blind eye to inequities, the underfunding of public health infrastructures, the failure of prevention, the failure to keep our people healthy, which I might argue is, is our failure to care. But we do see, based off of just what you were saying, Ibram, about, the people coming out way before we should be and protesting, their individual freedom of not being able to go outside. I believe that some people don't think of this as a failure, but they think of this as maintaining, the racial hierarchy. So I just wanted to hear a little bit more about what you feel about that, Dr. Mona.
Yeah, I've thought a lot about this, and there's so many lessons from this COVID pandemic that we tried to learn in Flint. It was, a failure of leadership that cared about public health. It was really all about putting dollars first. It was a failure to listen to scientists and experts and really deny them and dismiss them and threaten them. It also was this long-standing chronic underfunding of prevention and public health, and really creating this society driven by corporate interests, where we have minimal regulations and we tend to react more than be proactive. And these are all the same lessons that are playing out with this pandemic. And it keeps me up at night wondering, like, why do people not care, as you said, Nicole? Like, why? Like, we're all breathing the same air, and we're all drinking the same water. Like, just today, the EPA decided not to regulate a poison that was a rocket fuel ingredient that is known to cause brain damage, and they decided to take a hard pass, like, oh, we're not going to regulate this and impose any restrictions. Like, it is almost a sense of privilege that we will be, immune almost to the consequences of these actions, or maybe it is because we want certain populations to get hurt. Ibram mentioned the water and the air issues. We are increasingly learning that it's places with poor air quality, difficulty accessing water, like for hand washing because of water shutoffs, that are also imposing these risks. So not everybody has these same risk factors, and we continue to see that it is poor and predominantly minority communities, people of color, that share these burdens. These underlying burdens are not equally spread out through our community. So I hope, it is my hope, and it's the reason that I wrote this New York Times article this week. I hope that this national crisis, whereas Flint was a local crisis that obviously had ripple effects all over, but I hope that from this national crisis we finally learn these lessons. We cannot afford a future for our children where some have access to things like clean water and healthcare and strong education systems, when some children do not.
Right, totally. Well, it's interesting. That makes me think about something that you had said earlier about, kind of the individual versus community. And Dr. Kendi, you said in I think it was your latest Atlantic article, that those trying to open up America for the sake of individual freedom versus those trying to keep it closed for the sake of a communal kind of freedom. So on that note, thinking about how Georgia opened up too soon, what do you guys think is our responsibility as citizens and our responsibility as community members?
Well, I think what I really sort of sought to really just demonstrate in that piece was this distinction between individual freedom and community freedom. As many of the people who are protesting, or I should say demonstrating for their states to open back up, they're demonstrating in the name of freedom. They're making a case that somehow their freedom has been taken away from them. And it sort of reminded me in a way of the slaveholders' mentality, that the slaveholder desired a state that literally secured their individual freedom to enslave, their individual freedom to disenfranchise, to exploit, to rape, to impoverish, to demean, to even kill. And so it was like this freedom to, or the freedom to harm, which in our sort of case, in coronavirus terms, is the freedom to infect. And really I contrast that with the concept of enslaved people who were calling for freedom from slavery, the freedom from disenfranchisement, the freedom from exploitation, from rape, from killing, from poverty, which is the freedom from harm, which in coronavirus terms is the freedom from infection. And so I think each and every one of us has to think very deeply. Do we have the slaveholders mentality in which what we want to do, even if what we want to do is going to harm the community, do we see that as more important than what's best for the community? Or are we part of that collective community effort that is fighting for the freedom from infection?
Hmm. Dr. Mona, do you want to add?
You're brilliant. I completely agree. Nobody could say that any better. But you know, if we look through history, and obviously you're the historian, we've never been a nation of we. We have very much been a nation of I, and the I has always been the white male privileged population. If you look at our policies, we especially when it comes to children, we continuously are at war with certain populations, and rather than use science and evidence to put into place what is best for certain populations, we are always on the defense. There's constant threats to, for example, safety net programs like Medicaid and CHIP, and and strengthened environmental and public health regulations. So we don't do a good job taking care of each other. And throughout history, we haven't done a good job taking care of each other. And we tend to put others down so that we can succeed. And you said it obviously much more eloquently.
I mean, do you think that's, I'm sorry, go ahead, Ibram.
No, I was just going to say, and I think for the individual, I think of individuals, obviously we've been taught that if we're not exercising or striving for our individual freedom, then essentially we're subjected. I don't think we realize that actually we gain freedom. Individuals gain freedom when the community gains freedom. That's what enslaved people realized. I was not free because my community was not free. So I have to fight for the freedom of my community in order so I can get that freedom. And so many Americans are fighting for their own individual freedom while not realizing that by only fighting for their individual freedom, they are keeping the community subjected, and they are a member of that very community.
Right. I mean, both of your books, and I would say also Stamped from the Beginning, Ibram, have taught me that with ego and the fear of giving up any kind of power, people will not work for the whole community. So with knowing all that, what would a responsible phase-in look like in knowing kind of the medical and racial and inequities?
Yeah, I can start. So what I learned from Ibram's book as well, and from our experiences in Flint, it's been a lot about the preservation of self-interest. And what we have seen in Michigan and throughout this nation is that the self-interest are the folks on Wall Street and not the folks on Main Street. They're not our essential workers and the protection of their health and safety. So what I see as, a safe phase-in is the protection of all people, not just our stockholders. It's most importantly is the protection of the public's health. This is what we learned in Flint. Our disaster happened because in a move to save money, our water source was changed and people were poisoned. We cannot be driven by making decisions by dollars. It has to be what's best for people. And especially our most at-risk populations. So I also would love to see a return to science, one of the pre-existing conditions in this crisis. But really, it's been really, even before this administration, has been a dismantling of science, a dismantling of facts, and a dismissal and really threats to those experts and scientific voices who say otherwise. So I'd like things to be science driven and as protective as public health as possible. In medicine and public health, we are governed by something called the precautionary principle, which is really to err on the side of prevention and precaution. We can do this. People are seeing all the thousands of cases and the thousands of deaths, and there's almost become a sense of like shrugging our shoulders, like, oh, we can't fix this, we can't handle this, we can't stop this. The numbers keep going up, and as if there was no alternative to more deaths and more suffering. But we can do better. And there's examples throughout this world of other countries who have nailed this, who have figured out, who have been governed by science, who have been governed by public health rather than the economy and what's best for, you know, our corporate interests.
And, you know, I would say that I think we need physicians and scientists and public health advocates like Dr. Mona, who are at the forefront of thinking through precisely how we can reopen and safely. I also think that any sort of phased in reopening needs to think very deeply about the particular groups in a particular state that are currently dying or being infected at the highest rates. And we need to think very deeply about why. And first of all, we need to acknowledge those disparities. And so I mentioned earlier how Black people are dying disproportionately as a result of COVID-19, but it's the same thing for the Native American community. And Arizona, to give an example, Native people are about 5.3% of the population, but 21% of the people who've been killed. In New Mexico, it's actually even worse. In New Mexico, Native people are about 11% of the population, but they're 59% of the people who've been infected. And so any phase in New Mexico or even as Arizona has to really take into account the ways in which this disease is disproportionately harming Native people.
Yeah, and Nicole, if I can add, I don't want us to reopen. I don't want us to go back to where we used to be, because that wasn't working. It wasn't working for the majority of people. So I hope, and you know, that this is a window in time where we can really take a pause and realize, hey, we have all of these systems, be it education or healthcare or, you know, or the food system, that aren't working for a lot of people. So maybe we can put some great minds together and figure out a better way to move forward. We cannot just get back to where we were, because it was not just and it was not fair.
Right, totally agree. I mean, you know, on the point of bringing up Native communities, you know, and the way that our federal government works with tribal government and uses kind of the communities when it's, you know, most helpful for them. And, you know, in South Dakota, they tried to close down the border so that, you know, they couldn't have anyone coming onto the res. And, you know, the South Dakota government could not handle that. They could not handle being told that they were not allowed in, even for safety regulations, you know. But to Dr. Mona, to your point about, you know, kind of our future, something that, you know, I think about, I mean, a lot, and part of the reason that I do the work I do is the future that we can have. And so, you know, Ibram, using history, your books always outline how we can transform our society into an anti-racist society. And for any parent or anyone that has a little baby in your life, Ibram is coming out with Anti-Racist Baby, a baby board book soon. So I think it's just awesome that you're even thinking about those ideals at such a young age. And then, you know, Dr. Mona, I know you've championed UBI and policies rooted in science and desegregation and well-funded schools. And your own clinic is, I believe, a model of how what our society could look like when we're actually thinking of all the aspects that a single person needs in a whole community, you know? So I don't know, can you both tell us about the post-COVID future you'd like to build or what you would like to see?
Well, you know, I think that I'd like for us to first and foremost recognize the problem. And the problem, if for any of us who've been taught that the problem, the reason why, for instance, certain racial groups are being more likely to be infected or even killed, or even more likely to be unemployed, or be more likely to be suffering from food or housing insecurity, is not because there's something wrong with them. And if we believe that there's something wrong with those those racial groups, we're actually believing in racist ideas. And for us to recognize that there's no such thing as a not racist idea, that we either believe that there's something wrong with particular racial groups, or we recognize the racial groups as equals. And then we recognize that if a particular racial group is dying at higher rates, it must be because there's something going on in their society. And so then, and we recognize those as anti-racist ideas. And then we start to figure out, okay, what is actually causing, what caused the health disparities that persisted even before this pandemic? And then what caused the racial pandemic within the larger viral pandemic? What policies could we have changed? What policies do we need to change to create equity and justice? And I just want us to come out of this pandemic razor focused on transforming policy and power rather than people.
Yeah, I ditto that, you know, as a pediatrician, but also with a health policy background. I spend a lot of my time one-on-one with patients, and I, you know, have very much celebrated kind of the grit and the resilience of our patients who've, despite all these obstacles over the last few decades, been able to overcome and persevere and be so resilient in the face of so much adversity. And I think what's really shaped my my view of where we need to go is that we need to once again take a step back to realize, why are we putting some children and some populations in conditions that demand such overwhelming adversity and demand such overwhelming resilience on the shoulders of small children, where, you know, families have struggles, you know, putting a meal on the table and are living with all of these toxicities of life, and now this pandemic. So we need to stop once again celebrating those small percentage of children that are able to rise up from those situations. And we need to stop focusing on those individuals, like you said, Nicole, and really take a step back and open our eyes to why these injustices are there in the first place. So we all have to be students of history. And then, you know, if we can't look back, there's no way we can figure out where we are, and it's impossible for us to then move forward. And in Flint, you know, our water crisis didn't happen overnight. It was because of decades of greed and capitalism and racism and disinvestment and population loss and white flight, and the list goes on and on and on. And this is similar to many of our communities. So like Ibram said, we have to open our eyes to that past, that history, to realize where we are, and most importantly, to move forward. And it can no longer be on the shoulders of our most disadvantaged populations. We have to put in place the policies that demand equity. And as I argued in my piece this week in the New York Times, they need added resources. They need a form of reparations. That we cannot just expect you know, recovery when there have been so many long-standing historic injustices placed on communities.
I'm just going to read the quote from the New York Times that Dr. Mona wrote, because I loved it so much I considered getting it tattooed on me.
I think that's a great idea. Thank you.
You said that recovery and reconciliation require reparations and resources. To expect resilience without justice is to accept the status quo. So I guess I wanted, before I hop onto these audience Q&As that I've been texted, I guess I just wanted to hear one last time from you guys, you know, what is resilience with justice? You know, what does it look like coming out of COVID with justice? What would that mean?
Yeah, I mean, it would mean things like universal healthcare untethered to your employment. It would mean the elimination of child poverty. In Flint, we have a 70% child poverty rate, 70. And that's not okay. And that's not something we should just shrug our shoulders on either, because that's something we can fix. It used to be our seniors, the elderly, that had the highest, you know, were the highest demographic in poverty. And then we put into place policies like Social Security and Medicare, and they're not that population anymore. You know, it means, you know, unsegregated well-funded public education system starting at childcare. It means policies, like Ibram said, that can help bridge these inequities.
Mm.
Yeah, and I just want to sort of echo that the brilliance of that piece. And I can say, Dr. Moto, I'm sick of asking children to be resilient too. And I know in particular, Black children are oftentimes in this country treated like they're adults, and Black adults are treated like children. And I think we need to figure out a way to treat children like they're children, and adults like they're adults. And I think we just need to really build a society, of policies that are geared fundamentally towards creating and maintaining equity and justice. And I feel, people are resilient. I know my ancestors, are resilient. You could survive hundreds of years of enslavement, another 100 years of Jim Crow, and another 100 possibly years of the new Jim Crow. You're resilient, but even many, obviously, women who had to suffer through thousands of years of sexism, poor people who've had to suffer through poverty since the ancient era. I mean, humans are resilient. The problem has never been humans. The problem has always been the power and policies that humans have been put in place. And so that's what we really need to be thinking about.
Yeah, there's a great quote in Tommy Orange's book, They're There, where he talks about resilience. And he's like, Native Americans have always been touted as resilient. We've survived oppression and genocide and persecution and displacement. He's like, I don't want to be called, resilient for just having survived. He's like, we need to once again eliminate the conditions that place certain populations in the need to be so resilient.
Right. And the policies that make it so that they, stay within those kind of confines and aren't able to just lead their lives with joy and tender care, which it's my hope that the world we come into after all of this has that at heart. So we're gonna open up to audience Q&A. So if you have questions, please put in the chat. I have a few here. So here's one. Go ahead.
I'm just gonna, before you get into the questions, I think some of this seems like really overwhelming for people. I've been following the chat and people are like, oh, these are problems that have been happening for decades and how are we gonna fix this? And as much as the story of Flint is the story of like this crime, committed with absolute indifference to some of the most vulnerable people, it's also the story of incredible resistance and fighting the status quo. It's just, the story of how, everyday folks got together and said no, and fought back and created this model of hope and recovery. So like from firsthand experience, like I can share with you, and I'm sure others can share, that it doesn't have to be the way it is. And that we all have this amazing power within us to open our eyes to injustices that are happening all over and absolutely make a difference.
Right. Ibram, do you want to add to that, or you want me to give you a question?
Oh, I think she said it best.
Yeah, yeah. Okay, so I'm wondering if one of the speakers can address the issue of bias, conscious or unconscious, that doctors may have and how that is impacting the treatment of African-American patients, how we can ensure the resources, e.g. ventilators, are distributed equally.
I can start. So yeah, but you can add much more to it. So bias is racial bias has been in medicine and it has been part of medicine for quite some time. It's increasingly being kind of taught and made aware to especially a lot of our learners. If you go back to Tuskegee, to the story of Henrietta Lacks, there's been study after study that shows their bias in diagnosis and treatment. and outcomes that are afforded to different populations. For example, two patients can both come in with the same level of pain. African-American patient is given, for example, less pain medicine, is not believed as much versus the other patient. To present with the same kind of symptoms, that's a cancer diagnosis, one that has a delay in diagnosis. So there's a long history of racial bias in medicine. We are also seeing it now with COVID, with reports, for example, of the assumptions of DNRs for certain populations, as well as the rationing of healthcare. So we have to, when we look at these disparities, we have to really uncover all of the possible sources of these disparities, and that also includes bias in healthcare.
And I can just add that I think doctors' studies show, just like I think people in general are more likely to lean on their racist ideas or their bias in extremely stressful situations. And so if you're, for instance, is a pediatric ER doc, and so if the ED is packed with patients, and many of those patients are COVID patients, and you've been working 12 or 14 hours already, you're potentially more likely than another doctor who is at a hospital that's not overrun with COVID patients, where they haven't been asked to work as long, to essentially give different patients inferior care. And so part of this is, we know certain hospitals are being overrun with patients and others are not, which, I think is also making it more difficult for doctors to think clearly as opposed to think with their racist ideas.
So here's another one. I am always curious about what books activists are reading. What books are you reading now, and which books would you recommend to people who want to learn more and speak more of issues of racial and social injustice? I'm gonna just say both of your books everyone should read, so.
I'm reading currently a book called Wilmington's Lie, which is a narrative history of what's known as the Wilmington Race Riot in 1898, which essentially was a group of white supremacists who basically did a coup d'etat on the local government that was controlled by fusionists or white progressives in conjunction with local Blacks. And these white supremacists essentially, through violence, were able to overthrow this city's government.
So I just finished the 800-page biography of Frederick Douglass, written by a Flint kid, David Blight, which has made me think a lot about Reconstruction and how obviously it was failed post-Civil War. It was so failed that in Michigan just a few weeks ago, we had a legislator wearing a Confederate flag mask. I also just read Isabel Allende's book that played out in the Spanish Civil War. And for me, in my book, I talk about my great uncle who fought in the Spanish Civil War. So that had a lot of resonance. So I love reading so many different kinds of genres, but especially historical nonfiction.
That's awesome. Okay, so aside from resources shared in the chat and books by the authors, what resources do you recommend for white people so that we are better able to be effective allies?
Ibram, that's you.
So the question was, in addition to books?
Yeah. In addition to your
only read books.
In addition to your books, I said what other books or resources?
Okay. So, of course, I think a lot of white Americans have been reading White Fragility. I think it's also critical for Americans to read another book that came out last year called Dying of Whiteness, which I always recommend, by Jonathan Metzl, which really talks through the ways in which many policies that white Americans have been advocating are anti-white, let alone anti-Black and anti-Latinx and anti-Native. So I would say those two books. But I think first and foremost, for white Americans to realize there's no such thing as a not racist. And for people for white Americans to realize that in any given moment, we're either being racist or anti-racist. We're either thinking there's something wrong with a particular racial group or that there's nothing wrong or right, and we're recognizing the equality of different groups.
I would also just add two classics, which probably most people have already read. Just Mercy by Bryan Stevenson is phenomenal. The new Jim Crow, I think, is eye-opening for a lot of people who are new to the issues of their criminal and justice system.
So this is a question for you, Dr. Mona. Is there a relationship between traumatic impact of oppression and the immune system and susceptibility to infection with the coronavirus?
I think so, and that's kind of what that is really frames a lot of our work in Flint is the science of trauma. And what we're increasingly learning about early adversity and this concept of toxic stress. When people, especially young children, are exposed to household dysfunction or living in poverty or racism or housing instability, lack of nutrition, environmental toxins, it alters your entire life course trajectory in a very graded and predictable way. This heightened sense of toxic stress, and which is an excessive amount of stress. Like, it's good to have normal stress and physiologic stress, but this is a constant level of stress and trauma that changes your immune system, your nervous system, your endocrine system, which is your hormones. It even can change your DNA, the expression of your DNA, through something called epigenetics. And that leads you to having a higher risk of chronic diseases like high blood pressure, immune disorders, asthma, obesity. And we are learning that a lot of these chronic conditions are also the pre-existing conditions that put you more at risk to COVID. So living and growing up in a traumatic and a stressful climate literally messes up your bodies and your brains and puts you more at risk for other issues. And it also can decrease your life expectancy. So we have framed our previous public health crisis in Flint as a trauma, and we've holistically tried to put into place trauma-informed services, from mental health care to family support, and the list goes on. And then this is an added trauma atop that trauma.
Can you both actually talk about, just because I actually think both of your work, of course, not just your books, but the work you're doing, every day is a resource for people as a way of a model for what they can do, or just that helps them with information. So Dr. Mona, can you talk about your clinic and the way that you thought about designing your clinic? And then Dr. Kendi, can you talk about your anti-racism center, which is like I've known Dr. Kendi for a long time and knew him before this, and it's really cool to see you create a whole center dedicated to this.
So I can start. So I have the amazing privilege of still being a pediatrician in Flint, and I now direct something called a Pediatric Public Health Initiative, where we've sought to build a model public health program in response to our crisis to mitigate the impact of what has happened to our children. We can't take it away. I wish there was like a magic pill or an antidote that could take away what happened. But we are leaning on science, working hand in hand with our community to promote the health and development of our children. So things that we've been able to do so far are, high quality childcare centers, early literacy promotion, trauma-informed care, mental health services, Medicaid expansion, economic opportunity, because the list goes on of all these science-based, community-informed interventions that we've been able to put in place. And you talked about my clinic. My clinic is awesome. It is the only pediatric clinic that I know of that's on the second floor of a farmer's market. So nutrition security is a huge problem. We have no full service grocery stores in Flint. So rather than telling my patients, oh, you should eat avocados and kale, which is impossible, we decided to make the move to put our practice in a place where kids can get healthy food. We subsidize every visit. We actually write a prescription, just like antibiotics, for fruits and veggies that they can fill downstairs in the farmer's market. Because of the success of our nutrition prescription program, it was included in the US Farm Bill, which passed Congress, was signed by the president, and is now a policy. So now there's a national $25 million program to help kids everywhere, inspired by our clinic in Flint. We also have other wraparound services like a social worker and a wake office and mental health services and literacy support, and the list goes on. We're also directly across the street from the Central bus stop. You know, in the city that built cars, Flint, Michigan, transportation is the biggest barrier that our patients have to get what they need. So we're like, hey, let's be in a place where, you know, it's easier for families to get to us. Place where, you know, it's easier for families to get to us. Are not enough, but some of the things where we have really tried to address these social determinants of health. We've tried to address all those other things outside of medicine that can impact the lives of our patients and share those. So like, you know, I mentioned the policy, but the really neat thing about what we're doing right now are the ripple effects. We've been able to really kind of shine a light on the situation in so many communities, you know, Black, brown, white, rural, urban. Kids are waking up all over to the same nightmare as our Flint children have been waking up to: overwhelming poverty, lost democracy, you know, long-standing racism, discrimination, stolen opportunity. The list goes on. And the neat thing about what we've been able to do is put a bright spotlight on all those other situations and places, and work to fix those too.
Yeah, and I'll just say very quickly, in terms of our anti-racist research and policy center, we really wanted to build a university-based center that would be able to bring together some of the greatest minds and researchers who could then be in collaboration with policy innovators and makers and advocates to really think through some of the seemingly most intractable racial problems of our time. And so we're really focused on trying to bring together specialists to really understand and create research-based policy solutions to racial inequities and injustices, but at the same time responding to a new crisis like COVID-19. And so I mentioned earlier how we recently launched our COVID racial data tracker, and our website actually is going to be going live on Monday. And that's an example of, you know, essentially using our research expertise, partnering with the incredible COVID tracking project to make available, to make what has now become the most comprehensive data set, racial data set on the pandemic, and while simultaneously trying to build this network of public health advocates around the country who can use this data to address and assist and protect the most vulnerable populations in their communities.
So this is a audience question. How can advocates and academics work to make these ideas accessible to the broadest audiences possible? How have you been most successful reaching people who weren't necessarily open to them? It seems like this pandemic makes the issues very clear, but people's understanding of what is happening is so wildly different.
So, I mean, I can say that I've actually made a very conscious effort to really only spend, I should say, to really primarily spend my time engaging with open-minded people. And I actually think there are a lot of open-minded people who just don't know. And so we can spend all day long arguing with a closed-minded person when presumably we could have spent those hours much more judiciously talking to more open-minded people. And so I try actually to focus on open-minded people who actually are thinking based on logic and thinking based on evidence, and who have been thinking in a racist fashion. They just did not realize that. But I also, you know, even as a scholar, I think it's absolutely critical for scholars to make our work, make our research findings, to make the knowledge that we produce accessible to everyday people. And I know that in many ways, scholars are not trained to do that. We're trained to talk with other scholars. But especially in this moment, if scholars who have been producing the evidence, who have the expertise, are not communicating to the public, then who else is going to be communicating to the public? It's going to be the people who don't have the expertise, but of course are projecting themselves as having the expertise, and therefore the public is not going to be informed, and then the public is going to be harmed. And so I just always encourage scholars to take that extra step and translate and clarify their research for everyday people.
I completely echo that as an academic in the field of medicine and public health. I spend a lot of time talking to my colleagues about how we share our work. We publish in journals that maybe 6 people read, and it's in a language that is incomprehensible to the lay public. So when I was writing my book, or when I was deciding to write my book, it was a really purposeful decision that I wanted to write a layperson book. Like, I wanted to write a book that everybody, no matter what you do or where you are, could pick up and understand. It would have been easy to write a medicine book or a science book or an environmental public health book, but I wanted to be able to reach the public and share these really important lessons. And it's why I think both of us today have articles, this week have articles in Lay People magazines and journals and newspapers, whereas, we easily could have written for an academic journal, but the reach would have been so much less. I think that's one of the reasons, at least in science, that we're in one of these, science, this kind of science denial moment. Is I blame us partly as scientists, is because we haven't done a good job communicating our work. And this speaks for all disciplines. Like and partly it's because academics haven't been trained to do this. So we need to do a better job in the training of academics to speak to media and to write op-eds and to really communicate in other venues to get these messages across. So I completely agree with that. And it's one of my kind of focus areas, is to really get the academics out of the ivory towers, and to get them into the communities, and then to really work in partnership with our communities. So the story of Flint, and my story and my ongoing story, is a story of a team that came together, an unexpected team of folks in so many different disciplines. I used to be so siloed in my thinking as a pediatrician. I'm like, oh, there's nobody else who cares about kids as much as pediatricians do. And the beauty of kind of my story is that I was proven wrong time and time again, because so do historians, and so do teachers, and so do engineers, and so do all these other people. So it's been such a growth opportunity to be able to work in a very multidisciplinary, multi-sector, community-informed way. So it's all about kind of expanding who we are working with and communicating with, and really doing that in a humble partnership.
And Nicole, if I can just add, and I suspect Dr. Mona and I can talk about this specific thing all night. And if I can just add, I think in many ways, academics are trained to believe that if everyday people cannot understand our work, then it's not sophisticated enough.
Right.
And I think that what academics need to realize is that when we talk about translating or clarifying our work, we're not saying dumbing it down. It's literally clarifying it. It's putting it in language that holds the complexity, but that everyday people can understand. And to me, whenever people can't understand my work, I view myself as the problem, not those people. And I think if academics could sort of have that mentality, I think we would be better off. And let me just add also that there will be some people who, it doesn't matter what evidence or facts we present, it's going to be against their self-interest to imagine the existence of those facts. And I think academics need to realize that too. And that's why activists and grassroots organizations and those who are fighting for power are just as critical as the fact and evidence makers.
Mm. Yeah, I completely agree. In one of our ideas and action events, we talked about the importance of the importance of culture makers, you know, for the folks that aren't going to read the academic paper, even if it's, you know, written in layman's terms, that might not be the way in. It might have to be through that Netflix 4-series show or whatever it is, you know. To kind of your point earlier, Dr. Mona, based off the chat and maybe some people feeling, especially given everyone's individual reactions to the pandemic and the way that it, you know, it makes us, one day you're fine, one day, you know, you can't get out of bed. You know, both of you, to me, embody hope and joy. It's very interesting because both of your work and the way that you guys, just kind of the light around you guys when you're in the same room of either one of you or on Zoom as we are now, I feel like there's a lot of joy and hope in what the future can look like. So I'm wondering, and for me, I guess I get that hope and joy by reading your work, by knowing more truth, which makes me feel more free and makes me feel like there's more of a possibility. But I'm wondering if you guys have, you know, any advice or any thoughts on what the viewers can get to feel more hopeful.
I thank you, Nicole, and I agree, and that has been the driver of my work. Has been this concept of hope. There's even a chapter in my book called Prescriptions for Hope. But I don't use those words lightly. Like I don't just say to my patients or my community, oh, we're gonna be okay, it's gonna be okay. That hope has to be grounded and rooted in action. Our ideas have to create action. And that's what we've been able to build in Flint, is a lot of action and resources and services and programs and policy changes, not enough, to make sure that our children have a hopeful future. So it can happen. It takes hard work, it takes teamwork, it takes creativity, it takes persistence, you know, and it takes, you know, waking up every single day with a need to be grounded in the why. So I wake up every day, and that why for me are our children. It is the children that I am privileged to serve every single day. And they're the ones that wake me up. They're the ones that give me hope. They're the ones that inspire me. We now have something, we actually have a group of children that advise us on our work. They've named themselves, they're the Flint Youth Justice League. They have this amazing, beautiful logo. They're all superheroes. They all have superpowers. And they tell us what we should be doing. And which is really hard for me, I sit back, I close my mouth, and we listen. And I am inspired by our young people, our young people, these, especially this group of Flint kids. So what happened in Flint, like, you know, so many folks after Flint, they realized they had water problems, and Newark, New Jersey is kind of in the midst of a very similar water problem. And our kids in Flint actually had done virtual conferences with kids in Newark, inspiring them and giving them tips on how to advocate and use their voices and create change. So those are the things that give me hope. Is our children, but how we as adults can act like adults, and make sure that we continue to put into place the policies that they need to have the brightest future possible.
And I think for me, it's first and foremost, my hope is philosophical, in that I recognize that you can't bring about change if you don't believe change is possible. That literally cynicism is the kryptonite of change. And we have a lot of people who imagine themselves as activists, but who are the most cynical people. And that is in deep contradiction. And so I recognize that we have to have hope, because that's really what fuels you know, our incredibly difficult efforts to change, to transform this country. But then I also, you know, not to give away the end of how to be an anti-racist, you know, I'm someone who was diagnosed with stage 4 colon cancer, a diagnosis that 88% of people typically die within 5 years. And I talked about at the end of the book, how in many ways the United States has stage 4 cancer, and that cancer is racism. It's literally spread to every part of the body politic. And so right now we have a question. So do we just sit around and just let the nation die? Because the odds are completely against us. The racism has been here from the origins of this country. It's spread to every part of the body politic. Or do we decide to fight? Do we fight against all odds and imagine that, you know what, there's a possibility that we can still survive, that we can still outlive this racism? I don't see any other option than fighting against all the odds, because if we don't fight, then we're guaranteed to die.
Ooh, I guess on that, I'm going to end this. Thank you both so much for joining me on this call. It's been incredible and more. Thank you everyone who's attended, and we will definitely be sending out the link for this and all the links all the books and links that we've been talking about. So thank you all.
Thank you, Nicole.
Thank you, Dr. Mona. Thank you, Nicole.
Thank you.